Hello, everyone. Welcome to the Med to Be. Today we
Hey,
have the beautiful, the luxurious, the it girl, Horishama.
thank you, thank you.
Thank you so much for being here. It is truly a blessing to have you. Horishama is a newly minted doctor. Okay. She's a makeup guru, she's a dancer, and she's also a content creator. Lastly but not least importantly, she's also a woman of faith. And she has lived her life to fully encompass and take care of and nurture every part of her soul and her being. And so it's just so nice to have her here. She's also the first doctor that I'm having on my platform that went to medical school in Nigeria, which I think is super important for us to talk about. I know someone had requested hearing experiences beyond just people going to school in the US, which I agree is very important. And so I'm happy that I have someone here who is ready to give us an authentic and honest and true experience and story about her experience going to medical school in Nigeria. I have talked for so long. Let me give you the floor and tell us about yourself. How are you feeling today? How does it feel in this new chapter of your life? What's going on with you?
So thank you for having me here. I feel really good right now, like in this new phase. So I've actually been out of medical school for over a year now.
Yeah.
And I've had my internship, so right now I'm just like preparing for the next phase of like coming to the US and like doing residency in the US and all of that. But I'm really good.
So it's good to hear. And so I heard you talking about the new phase. Before we get into the newness in this chapter of your life, I always like to dial it back to the beginning to give the viewers a feel for who you are and how your journey in medicine began. So if you could please tell the Med to Be viewers what inspired you to go to medical school. What is your why?
You know that corny thing of, oh, I've always wanted to be a doctor. So,
We know
yes,
it. We know it. We know it.
I've always wanted to be a doctor. My aunt was a doctor, is a doctor. My uncle is a doctor. So I was just like, hey, since I was like in middle school. So that's how long I wanted to be a doctor. And because of that, a lot of the choices that I made and was made for me by my mom, like schooling in Nigeria was part of it. Because my mom was like, hey, I can't afford medical school in America. You're going to sit your ass in Nigeria and then eventually, right? But that was actually part of the reason why I did do medicine in Nigeria. But like, you wouldn't even believe it that before I came to medical school, I went to dance school for 6 months. So yeah, like for me, I was like,
Do you know
I
that?
had already gotten admission to medical school. I was like, Mom, I really love to dance. I want to do this. I made it like whole presentation, PowerPoint. This is the dance school I want to go to, Broadway Dance Center in New York. And like I got in and it was really, really good. It was really, really good. It was like a good breath of fresh air before
Mhm.
like I started medical school. So yeah.
Wow. Actually, I remember that. I remember seeing the videos. I loved them. Yes, I remember. That was beautiful.
Yeah.
That's beautiful. So then transitioning to starting med school, what was that like for you? Your first year, a new chapter beginning. I know with going to medical school in the United States, just from learning and speaking to other guests. So medical school is 2 years preclinical, 2 years clinical, and then you go on to residency. But what is that experience like for you going to school in Nigeria? I believe it's 6 to 7 years, but I will.
Yes. 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 So typically, it should be for 6 years.
Mhm.
So the first year, like, it depends on also when you begin medical school. So I entered medical school in my second year. So I did A levels, and with A levels, I was able to get into second year medical school. And that's also preclinical. That's the preclinical. That's the real preclinical year.
Mhm.
The first year in medical school is just like, hey, everybody's just doing basic science
Mhm.
courses, but like second year is when they're truly distinguished as medical students and start doing preclinical courses like anatomy, physiology, and all of that. The first time I wrote my A levels, my grades weren't good enough to actually get into medical school. So I had
Mm-hmm.
to do A levels again. So I already did an accelerated program. So instead of doing A levels in the typical 2 years, I did it in one. So when my grades came out, they weren't good enough to get into medical school in Nigeria. And so I had to stay back for like another year to rewrite my A levels. So that's
Mm.
actually how I got it.
Okay, nice. And usually so I'm imagining you taking the first time and finding out your score must have been a very like, ugh, like again, I have to do this again. So what I always like to talk about dealing with moments of struggle. I put it in quotations because life is full of highs and lows. But a moment that didn't go as well as you expected, rather. How do you deal with that? How did you deal with knowing that you'd have to take this again? I was talking to someone yesterday about like kind of my experience and feeling towards med school. I know what I want to be. It's just that sometimes I might have to do something that I don't want to, like take an exam again or, resit a course or things like that. So, how do you deal with those types of situations?
So I really think that at that moment, I really wanted to go to medical school. And I was given the option of, hey, you can, with these grades, you could get into pharmacy second year.
Mm-hmm.
And I was like, no, I don't want. So I think at that point, I was really sure of what I wanted and I was ready to go back and like take the exams again to be there.
Mm-hmm.
And obviously, clearly, I had support from my mom. So that was because I mean, she was going to have to pay for A levels again.
Mm-hmm.
So it was just not just the, oh, you need to take exams, but there's also another financial commitment to make and for somebody else to bear that. So I'm just grateful that I could actually have the opportunity to take the exams again. So I think it was just really, this is what I want. I know that this is what I'm meant to do.
Mm-hmm.
And I'm like, okay, I know I didn't do my best. So now I'm going to commit to actually doing my best.
And I like that you're honest about that I know I didn't do my best. So now I'm going to do my best. And that's real because when you fail at something, the truth is I'm going to speak for myself. The truth is sometimes sometimes you didn't actually put in your best the first time. You know what you could have done better. And yes, everything can be used for God's glory and everything can be used for good. But I think it's, again, I love that you're very honest that, like, yeah, I can put in more. Do I have a little bit more juice left in me? So thank you for sharing that. Thank you for being honest with that. So now you have the dream. I always say the dream, the vision of being in med school, and you made it. You succeeded. You got there. What was your experience like again? So, preclinical, clinical years. Did you prefer one to the other? What was it like seeing the manifestation of things you had studied in your preclinical years? Were you working 12-hour shifts? Was it very light? What was that experience like for you?
Okay, so with the way it works, so you're in medical school, ideally it should be 6 years. I'm saying ideally a lot of
Mm-hmm.
times because there are a lot of other factors that come into play when it comes to medical school, especially in Nigeria.
Okay.
So 200, so we call them, we say 200 level. So 200 level, 300 level, those are typically preclinical. And by 400 level, you should be in preclinical school. So that's when you write your first clinical exam.
Mm-hmm.
I would say, I mean, preclinical, I was a baby girl. I'm reading, but like, hey, if I have to go out, I am going to go out
Balance, yes.
and everything. But I think at a point, even during preclinical school, I know, you come into medical school with the initial drive that, hey, I want to do this, I want to be excellent and everything. And then you're hearing teachers say that, hey, no, we don't give distinctions here. It's really hard to get that. And sometime in your mind, you're like, me personally, I'm just like, hey, I pass.
Mm-hmm.
That's typically most times, unless I really, really want something and I'm like, okay, I want to be the best at it.
Mm-hmm.
But normally, I would just be like, hey, 80% is fine, 75 is fine, I'm good. And like they're like, hey, this is not attainable already. It's really hard.
Mm-hmm.
I'm going to stress myself. Am I really going to stress myself? So I think that was my approach
Mm-hmm.
that I was like, hey, I just want to pass. I just want to pass.
Mm-hmm.
Like I just want to pass. Like so I guess on a level I was giving some maybe barest minimum effort. But not in a way that it's like completely complacent and everything. But I know that I was just like, hey, it's preclinical, learn what you need to learn, these are the foundations. And then transitioning, like I passed my preclinical exam to cross to clinicals.
Mm-hmm.
So that was pretty nice, even though it felt like a hellish experience, like your first exam in medical school. You're like,
Yeah.
hey,
Mm-hmm.
and because there are a lot of times in the Nigerian system, people have receipts, so that's they fail the exam.
Mm-hmm.
They have to retake it while still trying to keep up with the material for clinical school. So it can be really like such a huge burden, and you have people like not even passing those receipts, so they have to go to the class below,
Mm-hmm.
like taking the entire year. So it can be really daunting, especially and during that time, everybody knows you're writing exams. So
Mm-hmm.
the whole university is like, oh, medical students are writing exam, medical students are. So you're like, hey, I can't fit. And then I have a story that because we have a reading room for medical students and other people like to come into the reading room, and people are like, because me, I don't used to play. If you're not a medical student, please leave our reading room. Leave it. And then I was not hearing that people were like, I want to even see if she passes. Ha! The pressure. So I'm really happy. But
Oh.
like for clinical school obviously like on a different new campus. So
Mm-hmm.
it's separate from the normal preclinical campus.
Okay.
So you're in the campus where the hospital is.
Mm.
Pretty So you're almost isolated in a bit from like maybe friends that you made while you were in your preclinical dorms and everything. So, but like the hours, I don't know how to explain it. You're there till they release you. That's how it works.
TBD.
You are there till like so if you're so usually so I started with medicine and
Mm-hmm.
surgery first before like we did medicine and surgery. I can't remember how the system goes, but we
Okay.
did medicine and surgery. That I remember first. And I remember like one of my first nights having a call and like we're there to like 12, 1, and like some of the residents is like, hey, you're not going to leave. I want to teach you at 2 a.m. Excuse me? 2 a.m.? Why?
What happened to the beginning of the day? What have you been
Thank
doing
you.
the whole day?
So those are the kind of things that could happen. But like obviously as you go up in clinical school, but like you're like a veteran now. So you're like,
Mm-hmm.
hey, you can't boss me around. I know my rights in a way
Mm-hmm.
like, hey, I know when I'm going to escape from this place.
Mm-hmm.
That kind of thing. But there are so many sections to it because and for the way we like the way this step one is here is that you do both your anatomy, physiology, biochemistry, as well as your pathology and pharmacology together.
Mm-hmm.
But for us, that exam is split. So the
Okay.
first year, your first year exams are your anatomy, physiology, and that. And then when you cross over to clinical school, you're now doing pathology and pharmacology
Mm.
as well. Yeah.
Okay.
So those are your second year, not second year, but like second set of medical school exams. And the way our rotations work is that you're like, you can rotate. Like I wrote my medicine and surgery exams in my final year.
Okay.
And that was like, so imagine doing something 4 years ago and being tested on it.
Crazy. Plus all the stuff you've already
Yes,
learned. Ooh.
exactly. So so those are the kind of things that can happen, especially with the more clinical exams.
Mm-hmm.
Sometimes they can be very far apart, but they typically give like maybe revision postings to like kind of revise the material that they had already taught
Ooh.
you. But it's been a while.
That's a lot of
As opposed to,
information. Yeah.
I learned it today, I'm tested on it like just a few moments later.
We.
Like,
Mm. Okay, so like how, so I guess like how here for clinicals they have like shelf exams. So like after every rotation they take like after their cardiology rotation they take a certain exam. So for you, you would take it totally.
No, so we
Okay.
have those as well. We
Okay.
have so what we typically call them are continuous assessments.
Okay.
So we don't call them exams. An
Okay.
exam is I'm in a hall.
Okay.
They're like invigilators.
Okay.
Everybody's like they printed the paper and like, hey, the kind of thing. So for us, for the CAs, so for the continuous assessments, you definitely have that at the end of every rotation. You
Mhm.
always have a continuous assessment,
Okay.
which is pulled towards your the exam in which that falls under.
Okay.
So typically, like okay, so the first year exams I already said were anatomy, physiology, biochem. The second year were pharmacology and pathology.
Mhm.
Which under pathology you have hematology, microbiology, and immunology, and like that. Then the third year is for pediatrics, and then for final year you have psychiatry, family medicine, medicine, and surgery. So under medicine, obviously, all the specialties are tested.
Go into that.
Under surgery, all the specialties are tested. So
Okay.
that's typically how it flows. I would
Okay.
say I preferred clinical school to preclinical because obviously it's pretty much more hands-on. You can see
Mhm.
what you're learning real time. You see patients, you're able to like correlate the things that you're learning and like building on it gradually. So yeah.
Oh, nice. Okay. Okay. Have a better understanding of it now. Thank you so much for explaining that. So you have preclinical going on, you have clinical going on, you're in the books, you're studying, working hard. But you also have so much life and happening outside of medicine. You are working on your content, you're working on your makeup, on your dancing, on building yourself and making new friends. Where do you find this time, please? Where do you find the time? And what are some things that helped you strike a balance or strike some sort of rhythm with working in school and working hard in school rather, and also working hard to solidify who you are?
I I feel like there's grace for that.
Mm-hmm.
If that's something that's of a priority to you. So for me, it was like for makeup, I was like, oh, I already love makeup. I love makeup even before I came into medical school, and I was committed to like still doing my makeup. And eventually, I had so much makeup that people were like, hey, why are you not doing makeup artistry and all of that? I was like, oh, okay. So like typically we have dinners, functions like amongst the student body associations within medicine. So like medical students, there's a medical student association. There's an association for the entire like so the dorms. So the dorms where all medical students, all so where we stay, medicine, dentistry, lab scientists, physiotherapy, you all stay in the same place. So you have all the different arms of medicine living under one roof. So that way there's an association with that. So each of those bodies have their own association. So if there's like a dinner, a function, I would like maybe do makeup for myself, my
Mm-hmm.
friends, things like that. And obviously make some small change on the
Mm-hmm.
side, that kind of thing. So it was only like during those times I would probably like be really, really heavy into makeup.
Mm-hmm.
The one I did more often was actually hair.
Okay.
So
Yeah. Yeah.
wigs, I made wigs in school.
Mm-hmm.
I like revamped wigs and stuff like that. Because sometimes you just like want that extra change to be able to do lots of things with money. It's typically hard to work.
Mm-hmm.
Like there are not like a lot of job systems within the Nigerian medical systems like afford you the time to like work. So maybe you're just doing things on the side, but it's very common. Medical students are like tailors,
Mm-hmm.
photographers, they run restaurants, like catering services, baking.
Mm-hmm.
So
Mm-hmm.
like it's so common to have like that was the environment of medical school. Medical students had other things going on, like other things going on. And because of the associations as well, we also like grew up like in a form of like politically inclined. service kind of system. So
Mhm.
we had senators. So for medical school, we have like a Congress, we have a Senate. People are elected, we run for elections.
Mhm.
So those kind of things are already ingrained into the system that gives you that opportunity to like really be something apart from being a medical student, but building yourself along those other leadership and lines. So
Mhm. Wow. So that's beautiful. It sounds like your school really helped you nurture yourself as a holistic person in addition to your additional efforts outside of what the school provided you. Yes, your wigs, please, this wig that you're wearing, beautiful. Eats down, beautiful. The makeup is giving. But yes, follow Orishama on all her social media platforms. She is one of a kind for real. Please, please,
thank
please.
you.
So definitely love to hear that. Love to hear how you grew into the person you are today. Um, I want to take you back just a little bit more into your medical school journey. I wanted to ask, is there anything that you learned about yourself while you were in medical school? Beyond the I can do hard things. I don't want the I can do hard things. Did you learn anything about yourself, about situations that you thrive in, high intense? Are you someone who likes to think, likes time to think about situations, your working style? What is one thing that you learned about yourself throughout your medical school journey?
One thing that comes to mind is I'm being able to pull people together to do something.
Mhm.
So I, while I was in medical school, I was the deputy hall chairman. So that's so for the whole of all the hall that covers all the parts of medicine, medical students that where we live. So there's a chairman, there's a council essentially. So a chairman, a vice chairman, a sports minister, a social and budgetary minister. So all of that, secretary and all of we have like a whole executive council, that kind of thing. So I was deputy hall chairman, and usually we plan for a whole week at the end, but typically we have activities that run throughout the entire council year. So one thing I noticed was that was really a lot of the things I even campaigned about, that like, hey, I can pull people together to be able to achieve something and build something, build relationships. And I think
Mhm.
that's something that I kind of deepened my knowledge about. I had already some glimpses of that while I was in high school, but like even in medical school, I was able to see that like bloom more. That if I entered a leadership role, I was able to like just bring people together to be able to do
Mhm.
something that meant something. So
I love that you are talented and gifted at bringing people together. And I think that will help you both at work as a doctor and in social settings as well. And so that's beautiful that you came to that realization. Moving forward, so where you are now in your journey, can you tell us a little bit about where you are right now? What you are, this phase of life, what does this phase of life look like for you as a physician?
so I'm currently trying to take my USMLEs and like going through the material. So obviously starting with step one and
Mhm.
everything, trying to go back to the bases. And I'm just like thinking to myself, why didn't I do this earlier? Why didn't I just do this when I was in medical school? But
Mhm.
I guess I made, like in hindsight, I would say like maybe I made some excuses due to the systems and the strikes and everything that happened in medical school that kind of would I say, for lack of a better word, like maybe butchered our calendar. So it wasn't running as smoothly as you should.
Okay.
So I felt planning those things into it would have just proved pretty difficult. But that's currently where I am, trying to just read for my exams so that I can plan for the match for maybe like 2025.
Okay.
So that's where my mind is at really. But like, like after like internship and I don't know, I'm going to just throw this in here. So yes, I am married. So like you just can't plan.
Oh, oh, okay,
So
wifey.
I just feel like there's a place of, oh, you're planning things for yourself.
Mhm.
And luckily for me, he's also a doctor. So we're currently in that phase of work
Elite.
together. So we're currently in that phase together. So it's planning that is really what we are. It's like, hey, how are we going to do this?
Mm-hmm.
We're going to take exams together. We're going to read. How we're going to build up our like CV and things like that. So that's just pretty much where I am.
That's beautiful. Okay. How did you meet your husband? I'm assuming it was in medical school.
Yes, it was.
And what was okay, okay. And what was dating like for you in medical school? What did that do you feel like it affected your focus in school? Do you feel like it made things lighter, made things easier? Especially since you were both in the same med school, I'm assuming. What was that like?
It definitely made things easier. Definitely.
Love that for you.
You know how you know, oh yeah, this person is the person I'm going to marry. So for my first,
I don't know, actually. I actually don't, but
so
okay.
wait, for my first year exams, he had already like crossed to clinical school, so he was in
Mhm.
clinical school, right? He came to read with me almost every single day till
Okay.
I wrote my exams. Even while I
Mm-hmm.
was writing my exams, he was there. So yeah, he definitely made things easier. And obviously, if somebody like has already gone through the process, he can tell you
Yes.
like, hey, this is where I think you should read. This is where I think you should focus on. So
Mhm.
it definitely makes things easier. And I
Mhm.
think like I mean for them it's like you're obviously in medical school, you're an adult. You're an adult, so you're going to have to make wise choices.
Mhm.
Wise
Mhm.
choices, that kind of thing. But it's pretty easy. It's
That's
pretty
beautiful. That's good to hear. It's always encouraging to hear that you can live life fully and grow your life fully, while still being committed to a part of your purpose.
yeah.
Um, so now moving forward from your life in medical school, your life now, let's bring it all together and let's chime it to those that are coming after you. So at the end of my interviews, I always like to ask my guests to direct a message to the med to be or to the MD to be, which would be the case for today. Someone who is thinking about applying to medical school, based in Nigeria, based here, I believe that the message is always important. I believe just by talking to you, there's a lot of similarities in the journey. There's a lot of similarities. There are unique differences, not just because of where you went to school, but because your life is different from mine. Your life is different, and there's a unique path that you have walked. But I believe the lessons and the values are all the same across the board. So, what is a message you can pass on to someone who's thinking about applying to medical school, someone who is in but is like having a very hard time, someone who is doesn't really know much about what it's like to be in med school and is curious, and who knows if this will inspire them to take that push, to take that exam or take that class. I've said a lot of words, but in summary, my question is, what is your to the med to be? You
So
can
I
take your time.
think
Think. No rush. No rush. No rush.
so for the person that's thinking about it, know that it's hard. And like I mean they always say this corny thing that choose your heart. So I think at the end of the day, medicine is a choice that
Mhm.
you have to make. It's not the hardship is from what I know, hardship is everywhere. Whether it's in
Mhm.
Nigeria, whether it's in America, whether it's in the UK, wherever it may be, medicine is hard everywhere.
Mhm.
So it's just going to like pick your heart and then commit to it. So at the end of the day, you truly need a whether you're thinking about medical school, in medical school already, trying to get matched, writing exams, whatever it may
Mhm.
be. I think one thing that is so necessary is a good support system. So, like having a support system that lifts you, builds you, encourages you, even throughout your journey. Because I think that's one thing that med school can truly give you.
Mhm.
Something that you can actually have people that truly see the world through the same struggles that you have,
Mhm.
and then you can hold each other's hands throughout that process. So that's truly where I really feel that you is the true take home that you need to when whenever it comes to medicine, because it can get lonely. It can truly get very daunting, especially like I mean you're taking exams, you're having to go through your clinicals, trying to have information, like get information. Because, like, hey, doctor cannot be daft. Doctor has to know, to sabi, to know stuff,
Mm-hmm.
right? So it can be truly daunting because there's an expectation that people already have,
Mm-hmm.
I mean, of you. So having the right circles and support systems, because the information that you need is actually out there.
Mm-hmm.
The information you need is truly out there already. So I think that that's a great take home for anybody in any
Mm-hmm.
of those cycles. And another thing is that I spoke to a so my mom has some friends that are doctors and they were classmates in high school. So you can imagine how long ago that is. And she tells me that, hey, medicine is truly beautiful, it can be truly fulfilling, but do not lose yourself.
Mm-hmm.
And that's a statement that has truly stuck with me because I truly believe that because of how encompassing, how much energy, how much mental, like energy, mentally, financially, emotionally, on every level that you have to commit to something so high demanding as medicine, it can be so easy to lose yourself, lose your interests, lose your hobbies, lose things, even people, friends. It's very easy to like absorb yourself in the process.
Mm-hmm.
So it's something that you have to be so deliberate as you're going into any process with medicine. Like, hey, this is actually what is important. I do not want to lose this in the process and then commit to like, I mean, if you dance, I want to dance once a week. No matter how crazy my schedule is, I want to dance once a week. Or I love going out. I want to at least go out once a week. Or if it's once in 2 weeks. But like there's a commitment you have to make from the get go,
Mm-hmm.
knowing fully well that this is what can actually happen if I am not mindful and intentional about doing those things that I do love along the way and along the journey.
Okay. Beautiful. And that's the end. I'm just kidding. Um, Thank you so much for sharing that. I wonder if we touched on this already. If there is anything you wish you had done differently in med school.
I
Yeah.
don't think we have touched on that, so
Yeah. Let's talk about it.
definitely speak on that. I wish I didn't let the circumstances of medical school change my heart
Okay. Hmm.
in the sense that there's a way the circumstances can be that even though we truly want excellence, we might settle for less.
Mm.
Yeah. So there's a way that it's the posture of our hearts that help us to be able to commit to the journey no matter what happens. And that way we're able to give our best and our all and not have regrets. So I think that
Mm.
that's something that I truly wish that I did. And I think that anybody in med school needs to be mindful of, hey, I know they said this is hard. They said, oh, this can be done, but I'm not going to take that, right? This is what I believe is possible and I can actually do that. So there's a place of guarding one's heart in medical school because some people can just, I mean, sometimes your senior students and senior in years above you can be like, hey, this is very hard. People don't pass this exam.
Mm-hmm.
Everybody always fails this exam. And there's a way that that can just truly weigh on you and
Mm-hmm.
affect how you actually truly approach it from a clean slate. So that's truly something that I think I wish I knew
Mm-hmm.
so that I would be able to come to.
That's beautiful. Wow. Gems.
Yeah, yeah.
Jewels.
You know,
Beautiful. Beautiful, beautiful words of inspiration and encouragement. Those are things that I have definitely will keep in mind, hopefully, as I move forward in my journey. And I know that the viewers will keep in mind as they move on in theirs as well, whether it's in med school or something else. I hope that they are continued. I hope that they are persistent and they are hopeful and encouraged because it is hard, but again, you have to choose your hard, you know? I think those are all the things I wanted to talk to you about today, and more actually. I'm so thankful that you took the time to talk to me today. It was a very quick turnaround time, actually. I texted her like maybe a few days ago. She's like, "Yeah," and this is like 2, 3 days later. So thank you so much again for being very open and vulnerable. It is not easy to share a journey that has been long, that has been hard, and that has taken a lot out of you, both your time and your resources. So I really appreciate it. And I pray and I hope that this video reaches the right person or the right people, and that they are encouraged by your story, and that they are encouraged by you, just who you are, how you exist, the baddie, the beautiful woman that you are, the woman of faith that you are, the doctor, everything as that you are. So I'm just really thankful to have you on this show. And I hope that this new chapter of your life, you working towards your being a doctor in the States, I'm excited for that day, excited to celebrate you in those moments as well. And I hope that people here will continue to send you positive messages and will love this episode. Any final thing? I don't want to cut you off early. Is there anything else you want to say to the people?
I think I'm good.
Okay.
I think I'm good. I think
Okay.
I'm
We've been talking for 40 minutes, so it makes sense that you're good.
yes.
We've been talking for 40 minutes, so it makes sense. Makes sense.
It definitely.
Yeah, it makes sense.
But
Makes
this
sense.
was definitely fun.
For sure.
People might not know, but I know Nneoma for a long time.
Yeah.
I've known her for a long time. She
Yeah.
just coming here. She's doing like, oh,
Hey, 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 hey,
yeah,
hey.
we're sisters.
We go back. We go back a little bit. We go back.
Actually, I think I am grateful for you reaching out. You might not know, but this actually is an answered prayer. I've been thinking to myself that, hey, I really want to start a podcast. I want to be on a podcast and everything. I'm like, and this came up and I was like, oh
Yes.
wow.
Period. Yes. God is
Just
good.
before I turn 28. Okay.
Yes. Okay. Oh, sure. Happy early birthday. Yes. Yes.
So
Yes.
this
Yay.
is this is an answered prayer.
Yay.
People are blessed. People
Mm.
are full and encouraged. Medicine is beautiful, but the highs and lows are guaranteed.
Mm.
They are
Mm.
surely guaranteed.
It's good
That's
to
what
keep it
I
real.
tell you. But
Yeah. It's good to keep it real, honestly. Well, I'm thankful to have you here. I will see all of you on our next episode. Thank you so much, Arshama, for being here. Have a wonderful day, and I will see everyone on our next episode, I hope.
yeah.
Bye.
Guys.
Yay, that was very wow. This girl wants to take my charger so bad. Go ahead, take it. My sister's waiting on the stands to take this charger. That's fine.
Well, no, how are you?
I'm good. I'm good.
When are you writing MCAT?